Welcome back to Unscripted. In this episode, we continue our conversation about somatics and specifically dive a little deeper into EMDR and brain spotting. Jenny has a decade of experience applying these techniques in a clinical setting, and this can really help you understand if this type of therapy is right for you. So stick around and enjoy.
Welcome to Unscripted, your guide to discovering the various options available to you in the integrated and collaborative medicine space. I'm Janine Borandi, and I've been treating patients with acupuncture for 10 years.
And I'm Jenny Poole. I'm a trauma specialist and somatic therapist with a passion for psychedelic-assisted psychotherapy. The objective of our podcast is to explore the various care options available. Through our years of practice, we've found that different modalities can complement each other and conventional medicine.
We hope our conversations resonate and help you find the right tools and specialists for your unique needs.
We believe in an advanced care model where the doctor is not the only expert. We encourage you to embrace a mindset where your practitioners are your teammates who ultimately empower you to take control of your health.
As with every episode, this is not intended to act as medical advice, and no patient-practitioner relationship is formed from subscribing or tuning in.
Well, and here's the thing people ask me, well, what if I can't find somebody like you that does body work and that also does some this somatic work and sometimes this hands-on work? I said, well, there is EMDR and brain spotting. There is neurodynamic breath work. There are so many different ways to mine releasing somatically. I went to a somatic conference from the Embody Lab. Dr. Scott Lyons hosts it, and his way of unwinding was using a small yoga ball and getting connected with the body and using a lot of I'm feeling this yoga ball in my body and now I'm unwinding it. There was another gal that got up that was talking about, she ended up working with actors and people that were acting and singing, and it was unwinding the fascia with very, very gentle touch in the abdomen so that the diaphragm could now open up and have more freedom to be able to sing louder, sing better, have clear notes. So it was, cool. As I sat there, I was like, there's 100 different ways to do this. But if you're not approaching unwinding distress, and I'll say this too, it's not just trauma, because I work with a lot of people that are really just stressed out. Yeah. So how do we reclaim equilibrium? How do we reclaim safety in the nervous system that sometimes has nothing to do with something traumatic that happened? It's that life is just so stressful and I have so much anxiety and I can't keep up. Yeah. It's like, okay, then let's reclaim safety in your nervous system. And that's what somatics are about too, is how do we help the body go, we have more equilibrium and safety so that we have more room on our bandwidth so that even if stressors are there, we now have the bandwidth to manage them versus our thresholds being blown.
Yeah. Do you have something that you give to your patients that will allow them to if they find themselves in a stressful situation, do you have something you give them that's like a timeout for them where they can just kind of sit at their desk or leave the room from where their kids are arguing or,
Yes, there's so many. Let me give you a few, because one that's really simple that we also organically and sometimes naturally do is coming up by the temples, take both hands, and people do this already when they're like, oh, my head's hurting, but see how I'm just gently in very small circles, the temple, and this is connected to the temporal lobe and just relieving pressure. So you start to relieve tension and pressure in the body and you start to make space in the body for whatever can be better processed. So when people are feeling that much tension and they're overwhelmed, the body's losing room, right? The thresholds are getting too full. So sometimes very small things, you can come in right here by the sinuses. It's very simple. Okay, we get a lot of tension surprisingly in our face. There's so many muscles. And I have them go out here, hit the arc of the cheekbones, and come down the jaw. And take a deep breath. And this is one thing that people get really inhibited by. Loud breathing is actually the louder that you be, the more that you can release, especially if you can get the vocal cords to vibrate. So sometimes I'll tell someone, hey, take a deep breath and let's start processing and resourcing and helping your body decompress. And they'll go.
Have you seen any of the studies they've done on Om?
Yes.
Om is the universal sound, right?
And it vibrates the vocal cords. So you're literally pushing energy and what I would call emotional debris and psychic debris and energetic debris out of your body. If you can like, so those big things are, like you're creating a vibration, which by the way, mimics those vibrations and the tremoring. The body, when it's looking to reclaim equilibrium, wants to shake some of this stuff off. And so, so when you create these tension releases, right, even this movement, you're creating movement. Now, let me tell you, I think sometimes an untapped resource, because most people, and sometimes it's crazy how much we care about what other people think. Like, well, I can't just like do this anywhere. I'm like, well, you kind of can. Is tapping.
Yeah.
Tapping sends a signal to the amygdala that even though there might be a stressor here, that we can work through it and that we're safe and that we're okay. And so I'll tell people, and if you look at the people who like do official tapping as a modality, there's a protocol of like where you tap here. Sometimes people are like, oh my gosh, I'm out of order and this and that. So sometimes I just tell people, just start doing something to connect to what's happening in the emotional body, to your physical body. And tapping does that. And if we tap in heart center, right, this is where we feel and we give out. Like we give out our feelings and we take in our feelings. A lot of that happens in heart center.
These are all acupuncture points too. And these are, so you've got this central line that goes up the center, and then you've got this line that traverses just lateral to the center of the body. It's the kidney meridian. And these are your spirit points. These are notoriously known in acupuncture as your spirit points. And these are all about making your way through the fight, like going into the darkest of days and being able to reemerge and come out and see the forest for the trees. And so a lot of people clinically, when they come in, I do find that they touch themselves here. And I'm like, wow, where is it? Let's palpate here and let's find and see where there's tenderness and where there's reaction. And sometimes, man, people will just cry. And I'm like, okay, that's where we need to be. Let's go find the spirit of that point. Because that's going to speak to you right now.
And that's why I tell people there are two places that you only ever tap, because you're trying to process and digest and work through any emotional debris that's coming up. It will either be heart center, throat, because we get a lot bound in here. We're either saying what we need to say, we're not saying what we need to say, right? There's a lot of energy that can get congested, emotional debris that can get congested in the throat or in the eyes. This is where we cry. So if we can just tap a little bit around the eyes and I always tell people, add in some deep breaths, because somatic breathing is like a big broom that you can just for free, come in
it is.
And sweep and out all of that emotional debris that you're gathering, that now you're connected to, that you're processing, because it's about resourcing how we process and digest rather than storing and stuffing.
Yeah. Right? I love that you said that.
Outlets.
They're like, your breath is the most bioavailable resource that you have. It's still free.
It's the freest thing we
can
do.
And it's so powerful
for somatics
to hypersaturate your body with oxygen and breathe into your lungs, like really fully expand your lungs and hold it there for a minute and allow it to slowly escape, and do that just a couple times. You don't need to tap. You don't need to do anything to give yourself a really healthy dose of medicine. Just breathe.
But that's why breathe
big and deep. It is going to change your biochemistry. I promise.
Well, and that's why breathing has become so much more popular. You're starting to hear so much more about somatic breath. Come do my somatic breath workshop. Come do yoga, and then we're going to have a special person that's learned somatic breathing to come in. And because it really is now showing that it's a great way to move psychic debris, emotional debris, and energetic debris out of the body. Again, I think of it as a big broom. And I'll say that a lot to my clients. I want you to start taking some big, deep breaths. And at times people aren't used to breathing that way, so they'll breathe very shallowly. So I'll breathe with them. Come on, match my breath. You're safe in here. You can be loud. You can be expressive. Let's move some of this energy out. It's like taking a little sweep to try and get the stuff out, or a big sweep to try and get the stuff out. And again, I will say this. It's not us that's healing people. We're holding a space so that we can open the door for the vessel to heal itself.
Yes. And you'll find your medicine amongst all of the different things that are available If it's breath work, awesome. If it's somatics, awesome. If it's acupuncture, right on.
There's like 1,000 modalities.
Craniosacral. There's just so much room for everyone to play.
Well, even yoga was healing. That's one of Bessel's research was around even just how yoga helped veterans overcome PTSD. It wasn't talk therapy. It was really helping them. It was once they got the body doing these movements and these poses and holding and breathing, because with yoga comes all the pranayama, breathing and all that different stuff. So it is interesting that once you get movement involved and somatics involved, now you're really helping the collective vessel heal. I'll say a little bit about brain spotting. It's a modality that I still find EMDR is really well known. If you hear someone say EMDR, there may be still some people for sure that don't know about EMDR.
Eye movement, eye movement, desensitization, and reprocessing.
Good job. Okay. Yes. So brain spotting is similar, where it utilizes the eye movement. And David Grond, who developed brain spotting, did EMDR for 2 decades. To this day, that man would say EMDR is a beautiful modality. What he found is that after processing, and he had clients that worked with him for a while, he had very serious professional athletes that were having performance issues in their athletic endeavors. And these are people that when you're in the 1% of athletic performance, you don't have a whole margin of error, or you just lose the gold, or you're now no longer competitive in your field. So he's helping these really competitive athletes kind of overcome some of the performance blocks that were connected to the traumas they experienced. And so we've gotten so far with EMDR, and I think it's, again, a beautiful modality. But he found that with brain spots that people would hold them as he was talking, then he started to notice. So while he was using the eye movement that comes with brain spotting, EMDR, with brain spotting, you can get really surgical and specific. So brain spotting, I think, becomes a more fluid. So EMDR is great for, protocol 1, protocol 2, and steps. Brain spotting, I'm not as bound to those steps. And so I can process sometimes very surgically, and then I can pull out. So I can really manage window of tolerance well. And again, I'm not saying that EMDR doesn't. It's just that I love using brain spotting because I think it's so flexible for me when I'm with my clients and I'm processing trauma, and they sometimes need to now stop and get out. And so the spot that they were holding, that they were activated in, they just break and come back to being grounded. And then we can really manage window of tolerance well, or we can keep mining whatever came back in that activation. And you guys can all do this. If you ask them what's your favorite Christmas, or what was your favorite holiday that you can ever remember having, or what was one of your favorite summers where you went to the beach, or you just ask them to remember something, always, if not almost always, you're going to see someone immediately shift their eyes and start accessing their short-term memory and their long-term memory for memories. And that is what brain spotting is that where you look can be connected to how you feel. And if something distressing happened to you, we can find that spot where the body's doing this, the nervous system doesn't feel safe, and we can very gently and carefully encapsulate that and then discharge it from the body.
I saw a therapist a number of years ago, and I was kind of in a bad place with a relationship. And it was the first time I had EMDR. And I remember doing the EMDR, and I was like, I kind of felt a little bit better. And she did this one session, she did brain spotting with me. And we just started talking about something super benign. And she drew attention to the fact that I was looking at an image, like a place on the picture on the wall over there. And then I would dart over to the door. And then I went over here when something was really difficult for me to talk about. She said, "What's over there?" And she drew attention. She was like, "I want you to understand what I'm doing here.
Absolutely.
That you have a safe place over here because you're always smiling and you're happy. You're remembering some delightful something when you're looking over here. And over there, you're kind of thinking about something. But when you go over there, you get dark. There's something over there.
Yeah.
Let's talk about what's over there. And I need you to keep looking at it." And it was really powerful. And I'll tell you what it did, because I think that a lot of us get this sense of I'm choking or something's stuck in my throat. I have this thing in my throat. And I have plenty of patients that come and tell me I have this sensation that something is in my throat, or I am choking, or I can't get it out, or I've been to the doctor, I've had an endoscopy, I've had all the scans, nothing is wrong with me. Well, this is what we call chi phlegm. It's something it's just energy that gets stuck here. And because we haven't been able to say what we need to say.
Yeah.
Okay. And in this relationship, true to form, I was not in a position where I could actually speak my truth anymore. It became really kind of frightening. But in that session, I walked away thinking, this is crazy. I don't know what she thinks she's doing. And it wasn't you. It wasn't you. It was a different one.
I love that you did brain spotting before you found me.
I did brain spotting before I found Jen. But the next day I woke up, and guys, I've had this experience throughout my life. As a kid, I learned, I came by this honestly because I had to stay quiet because it was safe for me to stay quiet in some places. So this is a pattern for me, and it showed up in this relationship. And after this brain spotting session, I woke up the next day and it was 80% gone. And I was like, that never happens. It usually takes months for me to crawl my way out of this crisis mode.
Yeah.
And regain regulation. And as much trauma training as I had done up until that point, I knew exactly what was happening. It worked. It got me out. And by the next day, it was completely gone. And it was so much more powerful for me than EMDR. And I'm not saying that EMDR wasn't effective, but damn, it was fast. And I felt better.
Yeah. And it speaks to the power of somatic work.
Yeah.
They're doing some somatic work and really understanding that there was something that was connected, that the eye field was picking up, connected to what was happening in the collective body.
Yeah.
When people say the eyes are the window to the soul, after working on thousands of bodies and doing thousands of sessions of mental health therapy, there is truth to that, is that even if I never did any hands-on work ever, I could solely help people heal with somatic breathing and brain spotting or something that has to do with EMDR with utilizing the eye field, because you can really manage window of tolerance, and you can pull people out of it, rake the gaze, and get them back to regrounded and saying, hey, we don't have to mind that anymore. We can mind that later once you're reclaiming safety in your body. Yeah. But isn't that interesting that it would take usually months?
Yeah.
And because you had a somatic experience and you're able to unearth that and discharge it,
was
that
crazy.
Now the body could recover and reclaim safety quicker. And that's what the three giants, I know there are more giants out there, but I will just, the ones that I have learned so much from the most and have built so much of what I do, Gabor Mate, Bessel van der Kolk, Peter Levine, they will say that a somatic experience helps move the needle on the body reclaiming safety and the body reclaiming equilibrium. And when I say body, I mean your mental body, your emotional body, and your physical body, because they are all cohesive together. And they want freedom and equilibrium and safety. And so it's the name of the game when you're trying to help the nervous system get out of fight or flight or freeze is, I'm safe today.
Yeah.
I wasn't safe then, but I'm safe today, and I can believe it. I can believe that I'm safe, and that the body, then the vessel, can return to equilibrium. And the body being such an intuitive vessel, if you open a door for it to heal, it is as a self-healing vessel. And I've seen it too many times. It will. Yeah. You just create the doorway for healing, and when somebody's ready, they will then heal. And they will come up with a lot of their own things that they need to mind and heal from.
Yeah.
And then work out. And then let the body, even just today, it was like, hey, where do you feel it in your body? So that while we're unwind, let your body unwind, move that neck side to side, move those shoulders back and forward. And sometimes people don't know. Well, I just don't know. Well, I allow my body to unwind. I bring into my conscious awareness that which can be repaired and healed, and that which can unwind. And so we can mechanically start unwinding, but inevitably, and I've never seen this not do it, people start to unwind however they want. So you start then with even what is a more mechanical process. Well, let's just let your body start unwinding.
Yeah.
Move your neck side to side 5 to 6 times. Take a couple deep breaths. Move those shoulders up and down. Start moving and then without me saying anything else, they start to just let their bodies unwind.
Yeah.
Because the body wants as an intuitive vessel, it wants to be in a place of equilibrium. It wants to reclaim that.
And I think that's why people love ecstatic dance and yoga and Buddha yoga.
Yes.
Oh man, Buddha yoga.
Just move.
You're just shaking and you're pounding and you're shouting and you're doing all the things your body actually does want to do. And it's such a powerful release, and you're not having to do it in such a way that, you're judging yourself and looking weird to the people around you. So those like yoga, that's a modality. That's medicine.
Dance.
Yeah.
People will connect to what resonates with them. And I have a lot of people that love to do yoga. I have a lot of people that would rather go to their dance class. And I have people that just kind of want to sit and shake it out. Or I have some people that love tapping, or that just grab one of their favorite essential oils. Because again, you're creating a sensory experience, right? Yeah. So you're recruiting and resourcing your senses to help create calm. And you're just breathing, asking my body to reclaim safety, asking my body to slough off any and all emotional debris, energetic debris, and reclaim equilibrium.
Yeah.
And you can do that in so many different ways. And that's why I think somatic therapy is the future of mental health. And also physical health in the medical community too, is the more that we embrace somatics, the more that you're going to see people deeply heal. And it's interesting because this is coming out there. So the holistic psychologist, Dr. Nicole Perel, she wrote a couple of great books. She has a really great platform. And one of the things that she's really starting to get more vocal about, which I think is beautiful, is that these unknown medical issues, she's like, if you don't think that there's some kind of psychosomatic connection, that it's not just these bizarre medical abnormalities and just mysteries, is that there is something happening in the body. And oftentimes it has to do with nature, nurture. What has happened to us? What are our experiences in life? How many times have we felt suffocated or unsafe, or we've had trauma, or we're just not happy and we've dealt with a lot of anxiety or depression? Like those things will create, if you look at the scales of health, it's not just what's happening to us physically that we put a lot of weight in. It's what's happening to us mentally and emotionally as well. Yeah. And that's what I love about somatic therapy and somatics, is that it's starting to bring in this mind-body connection where we say, hey, from the bottom up, we're going to help the vessel heal. Yeah. So that what's happening in the brain and the mind and the mental body can also now heal in the somatic body. Because the somatic imprint oftentimes is deeper than just what's happening in the mental body. It's what's being stored in our very cells of our body, in the very fascia of our body, right?
Yeah, I have 10 million things that I want to say about all those things you just said.
Say them.
So there's one thing that I was left with in the wake of my really powerful brain spotting session that day. And that is that my physiological phenomena was at bay for the moment. I was still very much aware of the pattern and the reality of my problem at the time. And I had better presence of mind to assess and manage it. And I was in such a better place because my body felt better. And that's a little bit of the collaborative work that we do. Is I will say to my patients all the time, like, let's get your body feeling better, because if you're feeling better in your body, you have a clearer mind. And it's within that clarity of mind that you're going to be able to do some of the really difficult, deep work on the emotional things that have happened.
Because now you have the bandwidth. Now you have the bandwidth to do it.
And you feel better inside of your vessel. And that's really important, is to make sure that you have those resources in your mind, in your heart. Because if you walk into an office and you haven't been sleeping well and you're drinking alcohol to cope, and you've got an angry boss because maybe you're not performing the way that he or she thinks you should, you've got all these confounding factors, that's going to be really, really difficult for you to dive in and do the deep work. And the deep work, it's just screaming to be done. And it's the hardest decision to make sometimes, is to say, I'm going to dive in. I'm going to do that deep work. But it's a beautiful reality on the other side of it.
Yeah, absolutely.
You do get to feel better long term with it.
1,000%. I will say this too, because I want to bring this up, because I think it's important for people to understand what becomes a healing modality can also become something that's not healing, depending on the timing and the way that it's used. Right?
Yeah.
So even something like EMDR, brain spotting, or any kind of somatic therapy can also, like any kind of trauma therapy has the potential to re-injure somebody in their trauma if you don't manage window of tolerance. Because again, you're trying to create healing and safety. So if you compromise safety, so there has to be an exposure and a threshold point that you eventually go, and we're done. Because if we push that threshold, now we're in injury territory rather than healing and repair territory. So it's one thing to push somebody's threshold to help create some healing and repairing and having to view sometimes things in the memory system that are distressful, only to the point that they can manage that before we return to grounding and safety, so that then on another day or another time, we can then continue to do that. You blow people's bandwidths, you blow people's thresholds, no matter how healing you're trying to be, you're now a part of what's creating re-injury.
Right.
So I'm going to say this because cold therapy and cold training right now is huge, like cold plunges. And as somebody who does structural body work and somebody who's mental health therapy, I love the idea of cold therapy and cold training from a physiological standpoint. Vasoconstriction helps reduce inflammation in the body. If you have an injury, cold therapy combined at times, offsetting, cold therapy, hot therapy, we're helping heal the tissues through these things. From a mental health standpoint, cold therapy, you're purposely putting yourself in distress and staying in it, but there's not a bear coming trying to kill you. It's more like, I'm choosing this distress. It's uncomfortable, but I'm going to stay in it. I'm going to grow my thresholds.
Yeah.
That's beautiful. But if you're in fight or flight and your system's distressed and you then go cold plunge or do cold showers or whatever, cold therapy now becomes something that's injuring your system. It's not creating safety in the system. You already had blown your thresholds, so you can't grow them right now because now you're just a part of blowing them. Yeah. And I do think it's important for people to understand that use those modalities for what they're meant to be, which is healing and repair. And if you're trying to grow your thresholds, what you're trying to grow is resilience. If your thresholds are already blown because your life right now is super stressful and you're in a fight or flight response, you're pumping out too much cortisol, cold training is going to be the last thing your body is going to get any kind of benefit from, because it's going to be only a part of the thing that keeps it stressed out. Yeah. It's the same thing with walking and running. You have something that's like all the things and exercise, but if they're in a stress response, sometimes really hard exercise actually just makes
it's just more
their
stress.
Cortisol and stress worse.
Yeah.
So I'm going to just use that example as a part of blanketing around a lot of modalities, is that if not used well and properly, and there's not attunement involved, that you can actually then become now a part of the problem rather than hold a healing space.
Yeah. And that is one of the reasons I love my modality so much, is it actually does help to really bring the person down into a rest and digest response.
Yeah.
Like, and like a reliable one, like, hey, let's recover your physical body from some of the stress you've been in. It's a practice, right? You come back week after week and you're finally like, you're in the presence of an excitatory stimulus with all those little needles. They're like, your body's kind of like, we're injured. We have all these stab wounds, run away. But no, like you're relaxed and you're warm and you're safe and the music is nice and the room is dark.
Yeah. And
you're falling asleep. And so you're starting to train your body that a stressful stimulus doesn't have to mean you got to run away. A stressful stimulus is now like, okay, I'm training myself to manage stress and pain better. Okay, now I can do some deeper work. It's the yin and yang. It's the balance between activity and rest. And that yin time is so incredibly important for restoration and being able to be present to some of the deeper work that is necessary to, fulfill that peace and that tranquility that we aim to have in life.
Yeah. I remember being on your table one time, and I remember having the needles in and really getting to these deep theta states and being really frustrated because my body was just wasn't as healthy as I wanted it to be. And I was in a stress response, as you know, because at that time in my life, like when I first met you, I came to Janine initially because a colleague had been like, you have some leftover respiratory distress from COVID. And so go see her and get some Chinese herbs. And then after talking to her, I was like, can you fit me in? I would like to come see you. And so as I'm sitting on the table, it finally hit me. I was like, it's like sometimes the plumber that doesn't do their own plumbing. I'm like, I am a trauma therapist with somatic therapy. And I have been sitting in fight or flight, and I'm actually letting my body have respite. And this is the way that I start healing, isn't to keep doing, it's to let my body reclaim safety and equilibrium and reduce stress. But it was, because I can say that all day long for the people and help them, but it was like this visceral experience in my body where I felt just how tired it was.
Yeah.
Just how depleted it was, because I made myself be so still, and I was still, and I was like, wow.
Yeah.
I was like, this needs some help.
It's the biggest medicine sometimes,
just
being still.
And I thought, okay, I need to do more of this where I reduce this fight or flight response in my body so that it actually can take advantage of the healing that I'm trying to do. Because even exercise, if my heart rate got higher than a certain level, like the very thing that was trying to help like be healthy for me was now a part of my stress. Like if I walked too fast, that's how depleted I was. And so finally, once I stopped being so depleted, got myself out of fight or flight, I was able to now start absorbing the healing that comes from the modalities that we put on board, even things as simple as nutrition and exercise. So that's my thing about somatics, and also any modality that you use, is that it needs to be used in a way that helps create healing, because so many people will muscle through things. Like I had one
no pain,
I spent
no gain.
5 minutes in the cold chain, and I'm like, you're the last person right now that should be doing cold therapy. Let's get your body out of a stress response and then do cold therapy. You're like, making my job harder. So, I think it's worth saying is that those things at times really need to be thoughtfully paced at times. It's not never, but it's going, hey, is this, I've even had a client that had too much brain spotting before they came to me. And so the idea of brain spotting was like, because it was just too much too fast, and window of tolerance wasn't honored. Yeah. And so it was like, oh, that's the thing that that didn't make me feel safe. Right. So I had to really recalibrate that so that eventually something like that modality could be a safe experience.
Yeah. Yeah. There's so much more to talk about.
So we'll have a part 2.
Yeah.
Thank you guys for tuning in. We have a lot to share and say, and we appreciate the audience that's listening.
Yep, absolutely. If you have questions about anything we've talked about this evening, please drop them below in the comments and tell us what you want to know more about
with this topic or other topics.
Yeah, I'd love to dive into psychedelics and how people are using psychedelics to kind of dampen the space around opening up and being vulnerable about their mental health. And I think that's actually something that might help me, because I'm just like, no, we're not going there.
When you look at somatics being a wave coming into the mental health field and also a collective field, so is psychedelic assisted therapy. It's, back in the day it was awakened and then it was shut down. And there's been so much research done since then. Dr. Bessel van der Kolk's one of the forerunners of all the research there, is that it's irrefutable, the therapeutic benefits that it's having to help people. So now instead of it being something that people need to shut down and be scared of, in therapeutic use and therapeutic arenas, psychedelic assisted therapy can be a beautiful way to help create healing. So we'll definitely be talking about that.
Totally. Well, thanks everybody for joining us. And if you want to connect with me, I'm at theacupuncturist_org on Instagram.
And if you want to connect with me, I'm at MEND, MEND, MENDCounselingCenter.com. And also Jenny, JENNIE _ Pool, POOL. And that's my Instagram.
Thanks. See you next time.
Thank you for joining us on Unscripted. I'm Jenny Poole.
And I'm Janine Borandi.
We hope you found today's discussion as inspiring and insightful as we did. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you.
Connect with me on Instagram at The Acupuncturist.
And you'll find me on social media at MEND Counseling Center.
Until next time, remember that the best gift you can give to those you love is the gift of your own good health.